I'm Therese Garrett, Behavioral Health Medical Director at WellCare of North Carolina. As a child and adolescent psychiatrist working in community mental health, suicide prevention is of the utmost priority. September is National Suicide Prevention Month, which provides us with an opportunity to highlight the issue and break the stigma. We want to remind those that are struggling that you are not alone, and support those who love people who are struggling in identifying the best interventions possible. In 2022, in North Carolina, over 1,500 people died by suicide. Close to 2/3 of those individuals had a co-occurring mental health diagnosis, with only a third of these actively engaged in mental health treatment at the time of their deaths. We have continued to see an increase in youth suicidality over the past few years. Most individuals who ultimately die by suicide see either a primary care or mental health or substance use provider in the year before their death, with close to half seeing their primary care provider in the 30 days prior to their death. This affords us with the opportunity to connect with and intervene with individuals at risk of suicide. Some are afraid that mentioning suicide will increase the likelihood that someone will die by suicide or have a suicide attempt. This is not actually true. Asking about thoughts of death and talking about suicide provides the opportunity for us to intervene with those we care about and to share the numerous supports to help those who feel there are no other options. Some of the statewide, easily accessible supports for someone to call, including the availability of supports through 988, the State Peer Warm Line, Hope for NC Hotline, and the recent addition of peer services for youth ages 13 through 19 through the Somethings app supported by the Department of Health and Human Services. WellCare of North Carolina is dedicated to strengthening access to suicide care, partnering with providers in the delivery of care, and harnessing the power of innovative technology to help individuals live their lives to the fullest. We work to ensure that our members have access to supports when in crisis, including through our 24-hour crisis line, education to members about crisis supports, and connection to needed crisis services. We also work to educate our care managers, providers, and the community on identifying risk factors for suicide and suicide prevention skills. Our care managers support members through screenings for depression, anxiety, and substance use disorders in order to allow for earlier identification of individuals at risk, using evidence-based screening methods and safety planning. We are continually striving to modify and improve our interventions through ongoing development and evolution of content to support our staff in provision of high-quality care for our members. We also are continuing working to provide additional resources and connections, including through educational and digital therapies, as well as care management and connection to formal psychotherapy and psychiatric services, in person or through telehealth, as we expand our provider network. Together, we can create a culture where mental health is prioritized and no one suffers in silence. Let's start the conversation and support one another, not just this month, but every day. If you or someone you love is struggling, please know that help is available. Talk to a trusted friend, reach out to a professional, or call, text, or chat 988.